nurses out there, healthcare providers, medical assistants, for that matter, custodians, dietitians, dietary workers, all of you who had been impacted by COVID and other things, please use this month to take care of yourself. Say, okay, I'm going to start now. I'm going to go and I'm going to go get some help, and I'm going to talk to people about what is going on with me, because you're very important. And I am stressed thinking about how much stress you could be under. So the fact that you went through it, that really says something.
Hey, it's Vanessa.
Hi, everyone. It's Keisha.
Well, it's good to be back with you, Keisha. How was your day today?
It was great. There was this wet substance that fell from the sky today. I didn't know what it was for a little while. It kind of had me confused. The rain came out of nowhere. So today I was a little shocked that we actually had rain in the area. But today is a good day. I'm so glad to be on here this week.
I know, same here. I am glad that you are back with us today. I missed you last week. We were talking about mental health. As you know, that May is Mental Health Awareness Month. And last week we talked about the ABCs of mental health. A, acceptance and acknowledgement. B, believe and balance. And C, commitment and confidence. So today, being May the 8th, it's Nurse Week, and also it's my mother's birthday, and you're a nurse. So today we're going to be talking about
And my husband's birthday. Happy birthday, Jerome.
Yes, I forgot. I always forget that him and mom have the same birthday. Happy birthday, Duran.
Yeah.
Them bullheaded Tauruses. But to celebrate nurses and to continue with our discussion about mental health, we're going to talk about mental health for nurses. So I just want to ask you, what are some challenges emotionally, mental health, dealing with your mental health that nurses have? What are some of the challenges that nurses deal with?
I think it's nurses don't give themselves enough grace, because, we have to take care of people who have all types of personalities, strengths, weaknesses, some that are nice, some that are mean, some that are verbally abusive, some that are physically abusive. So I think sometimes when we deal with those various people, we tend to beat up on ourselves if we say something wrong, or if we find ourselves getting mad, because we're human. So I think that that's one thing that causes a lot of stress, is just that lack of grace that we don't give to ourselves.
I agree with you 100%. We know that your job in itself is a high stress level job, and dealing with families along with the patients, dealing with doctors and their demands, that stress comes from all levels. So I agree. And we do need to give ourselves more grace, be more careful with ourselves, more kind to ourselves when you're experiencing these things, dealing with the patients, the families, parents, if you're in the children ward. So I get that. And you're having stresses, and then your own life, your home life. So yes, stresses are coming from all areas. So definitely giving yourself more grace, being kind to yourself. What are some of the things that you've done in the past to help balance out those challenges, to some of the self-care tasks or things that you would do?
I'm actually the poster child for what not to do. I'm just gonna keep it real. Even to this day, people say, "What kind of hobbies do you have?" And I'm like, "Hobbies? What's a hobby? What do I like to do?" Because all of my activities in my life have pretty much been around either my family or my job, my church. It was never where I felt that I needed time for myself, and I always had this thought process that I couldn't do anything for myself. Maybe just go get my hair done, But as far as doing something that was more personal, more self-fulfilling, I'm still struggling with that. Since I've been in this new season in my life and I have had to recreate myself, I'm trying to recreate myself with those self-care moments. And I still find myself going, I shouldn't want to do that. I shouldn't want to go somewhere by myself. I
Right.
should want to go with my family. Because I keep hearing, because that's how I was raised. You do everything for your family, and you do this and you do this and you do that until you're almost dirt tired, you know,
Right.
because it's your job as the woman and as the mother, wife, or whatever. So now I'm trying to focus on me more. Although I bought a Cricut and I said I was going to craft.
Okay. Okay.
That's it's it's more stressful than I thought it would.
Well,
Because learning
then
a new
we
thing
don't
can
want,
be
then that
stressful.
is not a craft that we're going to do. It is not supposed to add stress. It's supposed to relieve. So that's a no.
But I love, what happens. But I realized I do like crafting. I am starting to read again because I had a time, a few years where I couldn't read. So now I'm able to either read it physically for myself or do the audiobooks. Those are the type of things that I'm starting to do now. I used to go and get massages, but I stopped because of the changes in my financial situation. But that's something that maybe I would like to see back once a quarter. But I'm just thankful now with just being able to go get my hair done. If I can get that done once a month, I'm excited.
And you can make that, definitely, you can make that a self care day for you
Mm-hmm.
when you know that you're going to go get your hair done. So we know that's a finance that you're going to cover. That's going to be
Mm-hmm.
out of the household. But just make it a day where you do nothing else, where you relax, where you take a hot bubble bath before or after. Don't want to sweat the hair out after you've gotten it done, but just making sure that you relax and you take care of you that day. But what you did is you brought definitely some topics in our culture that have definitely been a mother, being a wife, and then being a nurse, the ultimate caregiver. You have been a sacrificial lamb, and you've told yourself that you can't do these things because I have to take care of everyone else. It's selfish of me if I do something for me, but it's not. You doing something for you, you being the best version of yourself is the best way that you can help others. Because when our tank is on E, you get out there in your car and see if it's gonna go. I don't care if you got a new motor, new tires. If your car
Mm-hmm.
on E, unless it's electric and if the battery is down, you're not going anywhere. It's the same
Mm-hmm.
thing with us. If we're on E and we're not refueling and filling ourselves up, we are not the best version of ourselves at all.
I do agree. And, being I don't do nursing the way I used to, I can't help but be concerned about people who are nurses who are still on the floor,
Mhm.
especially coming out of COVID, because, you hear about all the COVID stories because of my health challenge. When COVID hit, I literally picked up everything at my desk, left the building and didn't go back. Okay.
Mhm.
It was because I knew I couldn't. But just to
Right.
hear the stories of those who had to be there and watched all these people who died or dealt with all the families who couldn't actually entertain with their family, go check on their family, literally standing outside the windows, trying to talk to family members. They had a different type of stress that I can't even imagine. Okay. And just to see how some of them still didn't come back fully after that.
Yeah.
And
So we,
I'm hoping that people will go get therapy and deal with those thoughts. And a lot of people think, oh, they shouldn't. But that's a lot of grief that they're dealing with and a lot of
yes,
trauma. So I think
yes,
that in this month that we're talking about mental health awareness, and since we're talking about nurses, I just want to say, nurses out there, healthcare providers, medical assistants, for that matter, custodians, dietitians, dietary workers, all of you who had been impacted by COVID and other things, please use this month to take care of yourself. Say, okay, I'm going to start now. I'm going to go and I'm going to go get some help, and I'm going to talk to people about what is going on with me, because you're very important. And I am stressed thinking about how much stress you could be under. So the fact that you went through it, that really says something.
and Keisha, you brought up some good points, so I'm going to just read from the Journal of American Medical Association. It was reported 60% plus of nurses reported burnout in 2021, increased rates of anxiety, depression, and PTSD, post traumatic stress disorder, and higher rates of suicide, and especially among female nurses. since COVID.
Mm-hmm.
So what you just said tied all of that in. After COVID, yes, we've seen an increase of around, especially in the medical field. Some people had never, I mean, the last epidemic was 100 years ago. So no one was ready for that and equipped, and nurses, doctors experienced something on a level that I can only imagine what they went through. So what we're doing today and what we are about is definitely to help people seek the help that they need and get it, and being a
Please.
platform to get the information out there to them. So we're going to talk about some of the things that are happening with our nurses is burnout. That's when you're emotionally, physically exhausted. Compassion fatigue, as you were talking about, when you have all of this, I call it secondary grief from the
Mm-hmm.
patients, from their families, from the conditions of the workplace. Then you have morale issues in the workplace and moral ethic conflicts, when we know that if I'm faith based and I'm working in a facility that doesn't allow me to express that, then I go back and forth with myself. And then PTSD, once again, post traumatic stress disorder, and then we have that, we just put a band aid on it and we continue to go,
Mm-hmm.
go, 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 go. And we're in survival mode, or we're living on adrenaline, and we don't get the help and we don't seek that. So those are the things that a lot of people in nurses in the medical field are dealing with. As you said, our medical assistants, the custodians that was there dealing with
Mm-hmm.
the impact of COVID. I don't know if they're still called the unit secretaries, the people with the information,
Mm-hmm.
all everyone that was involved, and
Yeah.
some contributing factors that also played a part is high patient loads, understaffing.
Mm-hmm.
Like you said, many people didn't come back. So instead of me working an 8 or 12 hour shift, now I'm working 16 hours. I'm going home and resting for, if I have children, maybe 3, 4 hours, getting up,
Mm-hmm.
dealing with them, and then back at it again, 16 hours. Inadequate leadership support. All
Mm-hmm.
they're about, and unfortunately, it's true, it's a money machine. It's about getting them in, getting them out, getting this money instead of what it was in the past, about the person, not about a number.
Mm-hmm.
So also exposure to the trauma and violence. I know here, I think it was a year and a half ago at Methodist Hospital, a man came in and killed his, I don't even know if it, the mother of his child, after she had given birth, and two nurses. So
Mm-hmm.
dealing with that. And then poor work life balance. As you were saying, you just continue. You feel like, I can't take a day off. I can't do this. And even when I take a day off, it's for the family. I got to run DJ here. I got to go do this. I got to go do that. And we don't take the time to breathe. We don't take the time, as they say, to stop and smell the flowers. We don't take the time to take care of. And that is what we need to do. And that is what we're going to talk about. And the last thing that also brings a lot of stress, trauma, burnout to nurses is systematic and social inequalities. And we see it. It's not talked about enough, about the different races who come in and how they're treated. And if I'm
Mm-hmm.
experiencing that, if I'm seeing that, and because of the people at the top are, I can't say anything or I can't address it, then once again, that's that moral fight that I'm having within myself to do what's right. But then I'm getting paid and this is my job, and I can't go against the system.
And that's hard. It's always a challenge, and it's been a challenge throughout our profession, where patient loads and not enough staffing has been an issue, um, because there are a lot of people, of course, who don't want to go into healthcare because of the fact that they feel that they don't make enough money, and they feel that also that the work is not respected enough. If a person is a patient and they see a caregiver there and showing true dedication to providing quality care.
Mhm.
They're being rude and dismissive and whatever. It's hard. And just like you were talking about going into that next thing about having leadership that's supportive, that's like with any job. I'm not going to
Mhm.
just sit here and say, nurses are the only people who are going through it, because it's across the board, being that it's also with teachers, and we are expected to make the least but do the most with the least. Okay.
Yes.
I've actually had a former employer tell me that the reason why nurses were not paid much was because they're not the breadwinners. And I said,
Mm.
say what now? He was like, yeah, so there's no need to really push for um, there to be an increase in pay, because y'all usually are married, and your husband is the one that makes all the money. And I go, okay, yes, I was in that situation at the time where, yes, my husband did make more money than me, but that's not everybody's reality. It's like
Right.
you pay someone for what they have done, pay them for their work,
No,
pay them
the
for their
antiquated
expertise.
views like that's in early 1900s. We're clearly in the year 2000, 2025. So
Mm-hmm.
what are they thinking? You know, a
Yeah,
lot of
so when you
women,
don't have that support, come on, it's going to make you be stressed, and especially when you're dealing with a large single mother population, which happens
yeah.
to be mothers, and they have to balance trying to make least for less money, and also doing all of the other things that they have to do for their families, and then to hear, I'm giving my all, but you're telling me because I'm of my gender, I don't
Hmm.
deserve. So, that's something that will always affect mental health of nurses until we get our allies, in the healthcare field, and just period, to stand behind us and help us. Yeah, it's going to be an issue.
And with that, and that's why it is so increased with stress, burnout, and everything. With that, then these are some things that we need to look for, some symptoms when we're seeing the burnout. So the emotional side is hopelessness or detachment. Physical, sleep patterns are changing. We're not getting enough sleep, or their
Mm-hmm.
eating habits have changed. Then behavioral, they're absent a lot, or they start using drugs, whether it's alcohol, whether it's legal drugs, but they're abusing it. And then
Mm-hmm.
cognitively, they can't make a decision. They can't concentrate. Anytime we see any of this in any individual, but especially in the medical field, we see nurses, especially with the not being able to concentrate or not being able to make a decision. You have people's lives in your hands. So we want to make sure that at this point we're seeking
Absolutely.
out help. We're helping these people. These are symptoms. So
Mm-hmm.
whether it's your family member who's in the medical field, whether it's a coworker, whether it's anyone that when you see these signs, this is a time to get them some help. So, and some other things we can do is try to get the hospital to be better. So, one way is to make sure, and I think most do this, is provide mental health services, the EAP. I will go further than that, because a lot of times now I know I've had people reach out to me, and
Mm-hmm.
with a lot of things being telehealth, a lot of companies, that's the only way that you can do it is virtual. That's a way to start out. But when we're talking about behaviors, when we're talking about behavior therapy, sometimes it's better to be in person to help with this. So then psychological safety and open communication, making sure that they're getting the help that they're needed, going into HR and being open-minded, being a safe place for these people to talk to, having staff and wellness program. I know a lot of companies, and the crazy thing about it is in the business world, there's a lot of this, but in education, in the medical field,
Yep.
they don't have these. I know my husband's job has a wellness program where if you do all these things, you can get a bonus here or this, that, and the other. I'm like,
Mm-hmm.
where is that for the educators and for the nurses, the people who are out here all day long dealing with
That,
these mental challenges, and then
I
making
agree.
sure that scheduling is fair, making sure that I'm not overworking this person. They've done 80 hours in a week. Let's making sure that we are being fair to them. And that's one way to go to your HR, go to the board of directors at a hospital and talk about these topics and talk about these things to try to make it more comparable for your employees.
Mhm.
We need to make sure that we're training our leaders in trauma informed care, promoting leadership accountability when these medical people, whether it's your medical assistant, whether it's your nurses, when they're suffering from PTSD, when they are having compassion fatigue, that we're understanding that and we're realizing that and we're taking accountability and we're getting them the help that they need. Facility. Normalizing mental health, making sure that it is not a negative stigma to say, hey, I'm not okay right now. Making sure that we can get the help and the resources that we need without being frowned upon.
Yes, because one thing I want to say, being that I am a Christian, I know there are a lot of people who also have a challenge when it comes to getting help and praying. Okay.
Mm-hmm.
And my theory to that is that we should always say we were created in his image. So if we're created in his image, he allowed therapists to be created to
Mm-hmm.
help us. And there's nothing
Right.
wrong with praying and going to a therapist. And there's no one that says it has to be one or the other. It should be both. Okay. So that's something in our culture, especially among our
Brown and
Black
black.
culture, you're just supposed to pray about that, baby. What you going to therapist for, telling them people all your business?
Mm-hmm.
I'm telling these people my business because I won't be judged.
Mm-hmm.
It's unbiased. I can go there. They don't know me as well as some others may. They may not say some things, in my life that may change. I'm supposed to respond to something or whatever. But the main thing is we need to make it okay to go to therapy. We should be
Yeah.
able to be out in public going, girl, yeah, I got to go to therapy tomorrow at 8:30.
Right.
Not
Exactly.
you go to a therapist, girl. Oh, girl, she go to a therapist. Your friend's supposed to say, "Wonderful, girl. What
Right.
is your therapist's name? Are you getting some good results? Give me her phone number. Give me his phone number." And I think that will also help with stress if we make it normal for us to say it's okay to express our feelings. And I'm gonna go even further and say, men, I see you. We love you. And it's important for you too. Go to therapy. Therapy
Right.
helps everybody. Therapy is not just for women,
Yes.
it's for everyone. Therapy helps us all. So let's focus on that. If we all would just start there and just say it's normal
Right.
and support each other when someone decides that, okay, I'm going to go. Great things. I think that would help.
I can't remember exactly where it comes from, but I do know the scripture states that a wise man seeks counsel. A
Mm-hmm.
wise man seeks counsel. So if in the Bible it tells you to seek counsel, then counselor. Yes, we're going to seek
Mm-hmm.
God and make sure that we pray on it and he directs us to the right counselor to go to. But a wise man seeks counsel. And in the meantime, some things that we can do to make sure that we're using self-care is mindfulness. That's a form of prayer. Mindfulness, making sure that we are physically active. So get
Mm-hmm.
out there, walk, run, play with your kids, be active, making sure that we have access to therapy, as you were just saying, Keisha,
Mm-hmm.
making sure that we create boundaries and stick to those boundaries.
Yes.
Create boundaries for ourselves to make sure that so when I make a boundary for myself, I'm going to stick to it. And I gotta hold
Mm-hmm.
myself accountable. And then when I also make a boundary for Keisha, I got to make sure that she sticks to it too. Because what happens is we allow people to push that boundary, push that boundary, push that boundary, and then there's no more. There's no more boundary.
Let's be real. that is a whole lot of the issues, especially since we're talking about stress in environments for healthcare. You don't have to go in and work overtime just because they call you.
Mm,
Say no. But we have a low staff. Okay, no. But if you don't come, your coworker's gonna have to have 7 to 8 patients. Sorry that that's happening to them.
right.
No, we have got, and I have. That's one thing I can say. When I was doing floor nursing, that was always an issue for me. So make sure that you are saying no, or like
Right.
I have 5 grandkids. I love them, but sometimes I can't have all 5 of them in my house at the same time
Right.
because I have my own 11-year-old who comes with his own energy,
Mhm.
and so to have all of them at one time, I'll be like, "Whoo, no!" It may be okay. I hate to say it like this. Give me the boys this, time. Give me the girls next time,
Right.
and then I
Right.
may try to do all of them when we have more family here. To help support them all being
Yeah.
here with me. But yeah,
And Keisha, I
um,
think that comes from, I'm gonna say this, and it's not one of those things that people love to talk about, but it comes from generational dysfunction. And the reason I'm gonna say that is
mhm,
we have been in a matriarchal culture where the women were supposed to be the backbones for many reasons. The men weren't in
mhm,
the house. We can go all the way back to slavery, why men weren't in the household for various
mhm.
reasons. So we were
Yes.
supposed to take the brunt of everything. And then even when the men were in the house, the world has already beaten our brown and black men up. So we can't be that quote unquote nagging wife or that demanding wife or doing any of those
Mhm,
things. So we were told and taught, and then we took it on into our professions. We were told and taught that we have to take the weight of the world on and not
mhm.
seek the help that we need, because then, quote
Exactly.
unquote, we want that strong black woman. Girl, please. Girl,
Exactly.
please. The strongest man got some weaknesses, so it's okay. I'm gonna be strong black woman, but I'm gonna be weak today.
Exactly. Call me weak because I'm gonna say time out, flag on the play. I can't do
Right,
I can't
right,
do
right.
anymore. That
And
is
I
true.
think that's why it's been hard that we haven't been able to create those boundaries, because for so long we've been told we couldn't create the boundaries. The
Hmm.
boundaries were very muddy. So with that, just to get ready to close out, I'm going to give a few more tips for nurses. So while you're at work, take micro breaks every now and then. I know we may get our 15 minutes and our 30 minutes for lunch, but if I need to take a breather after I've just had a tough time with this patient, go in, take you 2 or 3 minutes, recoup, regenerate, watch a little short joke, something on TikTok or Facebook or whatever, and revive yourself. Then making sure that we're creating boundaries, that I'm not checking my emails from work when I'm not at work. Okay, and that's a boundary I've told my principal and I've told my coworkers. They know, hey, when I leave here, if it's real important, if it's emergency, you better text me, because I'm not looking at any email. I don't. That's a boundary I've created, because I have to give my family their time. And if not, because of
Hmm.
the fields we're in, because we are people who care and we give, and that's what type of field we're in, that will eat us alive, and we won't have anything left for our family. And that's not fair to them. It's not fair to you. So we have to make sure
Hmm.
that we create those boundaries and we don't step over that. And then
I
making sure
agree.
that you have outlets, making sure you have someone to talk to. If it's not anyone on your shift at that time, hey, make sure you have someone that you can text and say, "Ooh, this patient or this family or this doctor just da 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 da," and release that. A lot of times we don't have a way to release it. I could have just released it after it happened. I wouldn't have carried it on for 8 hours until I got home and then spewed it all out on my husband or my children or whoever.
Hmm.
Having that mindset of gratitude and writing things down. You know what, this patient told me that I was the best nurse, this family brought me some cookies, or this gave me a note. Be thankful. I made it to work and it was raining, I made it here safe, my kids are home,
Hmm.
they're safe, just making sure that we are focusing on the positives and making sure that we're grateful for even having a job to be able to care for someone. So we get these opportunities to come in someone's space and make their situation a little better. So I am so glad that we had these topics. And just in conclusion, mental health care for nurses is not optional. It's a necessity. And the foundational quality, and let's act in every way to make sure that we're creating spaces and opportunities for people to have healthy boundaries, to have a healthy mental state. And we're going to care a little bit more and be a little bit kinder to our nurses and our medical assistants. Keisha, I thank you for your willingness to share your experiences. That really means a lot to me.
And I thank you for thinking of the nurses, because I kid you not, sometimes it feels, at least when I was doing it more full time, it felt like a thankless job. So just to see that there is a focus and people are caring about the well-being of nurses, that's always wonderful to see.
Until next time, guys, thank you.
Hey, y'all, thanks for coming and tuning in and watching us today. We want you to make sure you look us up on Facebook, Instagram, TikTok, and YouTube. We want to be able to be connected with you.
Make sure you like, share, and subscribe.